Hello, welcome to Life Matters. I'm your host, Brendan O'Connell. In the past decade or so, surgical abortions in America have been decreasing, but are offset by a significant rise in medical abortions, whereby the pregnant teenager or woman takes a pill called RU486, often in the privacy of her home, to start the abortion process. What if, after taking the pill, she regrets doing so? And what if she changes her mind and wants to give birth to the child? Is there anything she can do to stop abortion from occurring? Today's guest believes that you can reverse the abortion process if one acts quickly. Today's show examines what exactly is a medical abortion and, moreover, gives hope to those who are in this medical abortion predicament. Our guest today graduated from the University of California, Davis Medical School in 1988. He did his medical residency in the city I used to live in, Santa Monica, at the Santa Monica Hospital, which is affiliated with UCLA. He practices medicine in San Diego County, and he's a board certified in family medicine, hospice, and palliative care. Other interests include healthcare ethics, NAPRO technology, and the Creighton model for natural family planning. In recent years, he's seen a real need for a website entitled abortionpillreversal.com. Life Matters endeavors to make known and heard the broad mosaic of the Right to Life movement. We hope you find today's show will save lives of both the baby and the mother. I confidently believe you'll find today's show to be unique, informative, content-rich, truthful, and thought-provoking. Well, welcome Dr. George Delgado.
Good afternoon. Great to be here.
Dr. Delgado, how did you get involved in the first place in the Right to Life movement?
Well, probably the earliest was the influence of my parents. My parents raised me to always respect life, which is the greatest gift that God has given us. And so growing up, we always had a very high respect for life. We always were a very devout Catholic family. Then I decided to go into medicine, and I always protected life. I never referred for abortions, of course, never did abortions, and always fought against euthanasia. Debated classmates in my medical school class about abortion and why it really was never a good option for a woman. And then as I got into private practice, once my wife and I had children, we started to pray the rosary in front of the abortion centers on Good Friday, and that really grew into a good habit for our family. Until about 10 years ago, then I moved to San Diego County to join Culture of Life Family Services, which is a medical group that is explicitly pro-life, and everything that we do is in accord with Catholic Church teaching. And so there, my pro-life involvement just deepened in doing speaking engagements, being in support of crisis pregnancy centers, and then the interest really grew from there.
I see. And then given your medical background, what led you to set up a website and the attendant organization dealing with abortion pill reversal?
Right. Well, for many years I've been using progesterone to treat women who have what are called threatened miscarriages. That's when it appears that the woman might be undergoing a miscarriage, and we can treat with progesterone and sometimes stop the miscarriage and save the baby. So I had a good knowledge of progesterone. And then in about 2006 or 2007, unbeknownst to me, Dr. Matthew Harrison, who's our Associate Medical Director of Abortion Pill Reversal, he had a call from a woman who had taken mifepristone RU46 and wanted to reverse it. And Dr. Harrison also had some knowledge of progesterone, and he used progesterone and was able to save the baby. Now, from there, 2007, fast forward to 2009, and again, I didn't know Dr. Harrison at this point, and I didn't know what he had done. Well, I got a very similar phone call from a sidewalk counselor by the name of Terry Palmquist, who is in Bakersfield, California. But she has a website called Lifesavers, and she has an 800 number where she reaches out to women all over the country who need help. And she had gotten a call from a woman in El Paso, Texas, who had taken mifepristone RU46 and changed her mind and wanted to know if it could be reversed. Well, Terry called me and asked me that question. And I thought, well, I've never read about it being reversed, and I've never heard of it being reversed, but I knew how, I had studied mifepristone RU46, and I knew how it works. And how it works is it blocks progesterone receptors. you can think of hormones acting in the body as keys that enter into locks, turn a lock, and a door opens. And that door opening is what we call the hormone effect. You can also imagine a receptor blocker being a false key, a key that goes into the lock but does not open the door. That's what mifepristone does. It goes into the lock but doesn't open the door, so it blocks the beneficial effects of progesterone. And progesterone is extremely important and extremely necessary for a healthy pregnancy. And that's why it's called progesterone. It's an acronym for progestational steroid. And so I knew that if we could somehow outcompete the mifepristone RU46 at the receptor site, then the good guys, the progesterone, would win. So with my knowledge of progesterone to treat threatened miscarriage, I thought we could give the woman extra progesterone to outcompete the mifepristone and perhaps save the life of the baby. So I quickly thought up a protocol and wrote it down, and then I looked for a doctor in El Paso, Texas, who would be familiar with using progesterone, and indeed I found one, Dr. Jonalyn Bellacura. I called Dr. Bellacura and asked her if she'd be willing to treat this patient. She said, well, sure, what should I do? And I told her what my thoughts were, and she went ahead and followed my directions, and we were able to save the baby. So that was a wonderful breakthrough there, similar to Dr. Harrison's 2 years earlier. Well, then after that, I started getting calls from people around the country who had heard of this and were seeking my advice, and pretty soon we had about 6 patients we knew of that had been treated, and 4 out of 6 the babies survived, and this looked like it was going very well. So at that point, decided to write a paper in the medical literature. Dr. Mary Davenport was my co-author, and we published this in the peer-reviewed medical journal called Annals of Pharmacotherapy. And this was the first article in the medical literature describing the reversal of mifepristone RU46 using progesterone. Well, then after that, I started thinking, well, people are calling me because they're interested in this, but I bet there are many people who don't know about this, and perhaps we need to do 2 things. One is we need to reach out to people, both doctors, pregnancy medical clinics, and patients who have taken the mifepristone and want to reverse it, to let them know there is an option. And number 2, we need to find a way to connect those patients with doctors, nurse practitioners, midwives, or physician assistants in their areas, because time is of the essence when reversing the mifepristone. So thinking about that, I thought, okay, well, what we need to do is we need to use modern-day technology. So we started the organization called Abortion Pill Reversal. Started it with a website, abortionpillreversal.com, which you mentioned. And I welcome our listeners and viewers to please go visit that website, abortionpillreversal.com. It has a wealth of information. There's a nice webinar there where I explain the whole process. It has special tabs for doctors and medical professionals, as well as for pregnancy resource centers and pregnancy medical clinics.
I see.
It's also a way for women who have second thoughts to go there and to explore that. Then if a woman decides she wants to reverse the mifepristone, well, we give her a second choice. We are all for choice. And so there's a 1-800 number there where she calls us and speaks to one of our nurses or physician assistant to find out more about the process. And then if she wants to proceed, we connect her with a physician or medical professional in her area who can safely and effectively treat her to hopefully reverse the effects of the mifepristone.
And just for our viewers, could you explain the difference between the morning after pill and the abortion pill called RU486?
Yes, sir. Yep, Brandon, that's frequently confused. And the abortion pill refers to RU46 mifepristone, but it can also actually mean other, quote, pills, such as methotrexate. But for the most part, it's mifepristone, but it's any pill or medicine or drug that's taken with the intention of killing a developing baby in the mother's womb. And this is taken by women who already know they are pregnant with the intention of causing a medical abortion. Most of the time it's RU46 mifepristone here in the United States, but like I said, methotrexate has been used here and in other countries, as well as misoprostol, the second drug in the mifepristone cocktail, can also be used directly as an abortifacient. While on the other hand, the quote, morning after pill is marketed as a contraceptive, and it is taken within 72 hours of intercourse. So a woman doesn't know if she's conceived or not. She just doesn't want to be pregnant, and so she takes this. There's lots of controversy about how it works, but the latest articles that I've read are highly suggestive that the morning after pill is not very good at stopping ovulation unless it's taken within a very specific window before ovulation. But it does have effects on the lining of the uterus and how sperm can be transported and how a new embryo can be transported through the fallopian tube. So it likely does have significant abortifacient properties, but it's taken by a woman who doesn't know she's pregnant. So it can have sort of that very bad side effect, of course, of being abortifacient, but that's not, at least not the stated intention.
I see. Now, what are the side effects, and perhaps maybe the more severe side effects can happen to someone who has taken the abortion pill RU486?
Well, the severe ones have been death, and these have been cases where women have taken mifepristone, have followed it a few days later with the misoprostol, which is the prescribed regimen. The mifepristone kills the baby. The misoprostol causes uterine contractures to expel the baby. And there have been about 10 deaths in the United States. It's the hypothesis is that these women had all taken the misoprostol, the second drug, vaginally, and that taking it vaginally or between the cheek and gum increases the levels in the blood, and that this may stem the immune system. There have been other cases, women who have taken mifepristone who've had severe bleeding, even requiring transfusion, severe uterine cramps, back pain, abdominal pain, lowered potassium in the blood, increase in blood pressure, joint pain, dizziness, fluid retention, and other stomach side effects.
Now, what about? Is there infection? If you could that be a possibility also when you?
Infection is definitely a possibility. Not just a severe life-threatening infection I talked about, but just any time that you perform a medical abortion or a surgical abortion, you are causing the cervix to open, and when the cervix opens, the biological barrier between the outside world, which is not sterile. In fact, the vagina is full of bacteria. Many of the bacteria that are in bowel movements are in the vagina. Well, there's no longer that biological barrier separating that outside world of bacteria and the inside world of the uterus, which is sterile. There are no bacteria normally in the uterus. And so you break down that barrier by opening the cervix, either mechanically or with drugs, and at a time when the inner lining of the uterus is not expecting to be exposed to bacteria, well, then you're going to have a risk of infection. So there can be what's called septic abortion, which is an infected uterus due to an abortion.
Mm-hmm. And I know that I think mifepristone is RU486. That pill is much more expensive than misoprostol, the second pill that they take in the regimen. Could you tell us the regimen and the timing of this? For instance, say a woman gets this RU486 pill and she goes home and takes it. How long is it before it is effective? And then when are they supposed to take these other pills? Is there a time window?
There is, yes. So the first pill is called mifepristone or RU486. They generally don't take that at home. In the United States, the current standard of care and the FDA approval is for it to be supervised ingestion. In other words, in a clinic with a doctor or nurse or one of the clinic workers watching the patient swallow the pill. There are some states where they have telemedicine administration, which is very impersonal and unfortunate, where a woman sits before a computer screen and has a computer dialogue with a physician or a nurse practitioner, and after all the questions are asked and the medical professional is satisfied that the patient is ready to take the mifepristone RU486, he or she presses a button and a drawer opens where the woman is, and she takes the pill and swallows it in computer view of the person on the other side of that Skype connection. Then the second drug is called misoprostol, with a brand name of Cytotec, And Cytotec, like you said, is a lot less expensive because it's been approved and around for a long time. It can be used to treat gastric ulcers, although it's rarely used to treat gastric ulcers. It can also be used to treat postpartum hemorrhage, bleeding after a woman delivers a baby, although it doesn't work as well as Pitocin. And so a woman is instructed to take those pills, and there are usually 4 of them because they're 200 microgram pills. They usually take 800 micrograms. They'll take those pills home, and she's instructed to take them anywhere from 24 to 72 hours later. And the reason they do that is because if you give both pills at the same time, the whole abortion process is not as effective. Because the first pill, the mifepristone, by blocking progesterone receptors, very specifically attacks the placenta or the chorion, which is the forerunner of the placenta, in order to cut off the nutrients to the developing baby and then causing some placental separation. The mifepristone also blocks progesterone receptors in the uterine muscles, so that the uterus, and progesterone normally relaxes the uterus, and so it puts the uterus in a higher state of alert so that it will respond more to the misoprostol or Cytotec, which causes the uterine muscle to contract, to squeeze. And it also, the mifepristone, by blocking progesterone receptors, starts the process of opening the cervix. The second drug, the misoprostol Cytotec, opens the cervix further. And so essentially what you have is a 1-2 punch. The mifepristone RU46 first kills the baby, primes the uterus for the misoprostol, the Cytotec. The second drug, the Cytotec misoprostol, then causes the uterus to contract to expel the remains of the baby.
I see. And does a medical abortion procedure where these pills are involved, does it ever fail, or does there need to be follow-up surgical abortion in some cases?
Yes, there are failures, and in the FDA studies, less than 7 weeks, there was about a 2% failure rate. And it's interesting, you have to know what they mean in these studies by failed abortion, or they often use the term incomplete abortion. What is meant by incomplete abortion is that the contents of the uterus were not expelled, that there was still something in the uterus. An incomplete abortion does not imply that the baby's no longer alive. It simply is that the contents were not expelled. So the earlier studies just using mifepristone only, RU46, the failed abortion rate was anywhere from about 10% to 20%, and that's why they added the second drug, the misoprostol. As far as how many babies survive that mifepristone, we really don't know. That hasn't been well studied. But we do know that the failed abortion rate was about 10 to 20%. Using the 2-drug cocktail at less than 7 weeks of gestational age, the failed rate is going to be at about 2 or 3%. If you're using it up to between 7 and 9 weeks of gestational age, the incomplete abortion rate will be somewhere on the order of 8 to 10%. And so those women generally will require surgical abortions, or sometimes they will be given second doses of misoprostol, the second drug.
Mm-hmm. I see. And the progesterone you've mentioned is the thing that counters it. Is there data of large case series of mifepristone reversals?
Mifepristone reversal, yes. So I told you about the first small case series we published. We now have had another, besides those 4 births, we've had another 87 births of successful reversals using progesterone to reverse the effects of mifepristone RU46. There probably are others out there that we are not aware of, but these are the ones that we've been able to follow. So we're very excited about that. We're closing in on 100 births, and our success rate has been between 57 and 60%, in that range of successful reversal.
And so how quickly after the woman takes the pill does she need to act to get on the phone or get on the computer and find you folks? Is it within 48 hours or 72
Well, it's
hours?
as quickly as possible. We've had successes up to 72 hours after the ingestion of mifepristone. Mm-hmm. However, we feel that the sooner the better, and so our goal is to try to get the progesterone on board within 24 hours of the ingestion of the mifepristone RU46.
And what is the protocol to reverse the mifepristone?
Our standard protocol is to use injected progesterone because we feel that you get higher levels in the blood with injected progesterone. So we want the first injection administered as soon as possible. We get an ultrasound to confirm that the baby is still alive, because we don't want to give progesterone, of course, to women who are not carrying a live baby. And then after the first dose, we give a second dose the next day and a third dose the third day. So 3 doses in a row. Then progesterone every other day for 2 weeks, or until 2 weeks after the ingestion of the mifepristone. So that's another 8 days. And then after that, twice a week until the end of the first trimester. So the reason we do it that way is because we know that the mifepristone, first of all, needs to be reversed, so we need a lot of progesterone on board early. Then there may be some stunning of the placenta, so it may need to recover, so extra progesterone is not going to hurt. And then we know that the placenta will be making more progesterone by the end of the first trimester, so that's why we go all the way to the end of the first trimester. Now, we have an alternative protocol for women who are don't want to get shots, or for some reason can't get shots, or the doctors don't have the injected progesterone, and that's to use progesterone either orally or vaginally, and that's given every day. And right now we're collecting data to see how effective the different protocols are. And doctors, of course, are making up their own protocols as they go along, sometimes doing things a little differently, so we're going to study all that. And then in our next paper, we'll have some suggestions as to which protocol or which mode of delivery is the most effective.
And what are the challenges and barriers to the abortion pill reversal that you face?
Well, there are lots of challenges. One challenge is misinformation and really outright lying by abortion centers to patients. We've been told time and time again that by women who've called the abortion centers after they've taken the mifepristone to express their wish to reverse the effects of it, that they've been told there's no way that can be done, or they've been told that for sure your baby's going to have birth defects. They say for sure. And so this is either misinformation, ignorance, or outright lies. It's either they're lying or the people at these abortion centers are not reading the medical literature, because it's now established that mifepristone can be reversed, so it is possible. And it also is established that mifepristone is not associated with any significant increased risk of birth defects. There is medical literature out there supporting that. And so women who call are often they're lied to, and so that's one of the biggest hurdles and challenges. The other is sometimes we don't have doctors in the area where the woman is, so we need to recruit more doctors, nurse practitioners, pregnancy medical centers, midwives, other healthcare professionals who can help these women. We want a provider within an hour of every woman in the country. That's our goal. Right now we have over 250 different doctors and centers in our network, but we want to grow that.
I see.
Other challenges are sometimes the families, the fathers of the babies are not supportive. Sometimes the women are abandoned, either before they're pregnant, when they find out they're pregnant, or when they find out that they want to reverse the abortion.
Mm-hmm. And finally, how does your faith motivate you to get involved in reversing medical abortions?
Well, like most people who have faith, I think faith really motivates me to do everything I do. Everything in my life, every thought, every action comes from the Lord. And so right now in our society, the greatest threat to the dignity of the human being is the attack on the most vulnerable in our country, in our society. The most vulnerable, of course, are those in their mother's wombs. And that's the place that's supposed to be the safest for anybody. But unfortunately, we have a current situation where mothers are enabled and encouraged to take measures to kill their unborn babies. And we have people in society who are profiting from it. We have people who are profiting from it monetarily. We have men who are profiting from it because they have sex without consequences if they have resort to abortion. We have women who are being victimized by men by other women who purport to support, quote, women's rights, and they're being manipulated and they're really being abused by the abortion industry for monetary profit. And so, in this day and age, this is really where the rubber meets the road, where the cross meets society, and where we really have to put our efforts in order to end this attack on innocent human life, and end this attack on women who are so vulnerable at this stage when they are pregnant.
And once again, Doctor, what is that website that folks can go to find out more?
It's abortionpillreversal.com. Abortionpillreversal.com.
Well, thank you so much for calling all the way from San Diego to here in Boston. We hope you learned a lot today regarding how one can reverse a medical abortion and hopefully can save both the mother's and the baby's life. Thanks for watching. I'm Brendan O'Connell, your friend for life.